you come to our clinic today?
But I think I have a shoulder pain.
Oh, do you think you fall just now or last week?
I think I got this shoulder pain when I play netball around last week.
Oh, so let me assess first, yeah? Can you do this action, like raising your hand first, slowly,
I cannot lift my arm.
because of the pain?
Yes.
Oh, okay. I think the most suitable treatment for you is joint mobilization. It purposely to reduce your pain and increase range of motion of your joint. So, I think we can start the treatment.
Right.
We're gonna talk about joint mobilization. So, what is joint mobilization? Joint mobilization is a passive movement performed by therapists at a speed slow enough that the patient can stop the movement. It has two types of method, which is oscillating and sustained. It is depending on what the intention of the treatment, which is oscillating is to manage the pain and sustain to increase the joint range of motion. For you guys' information, we have three types of joint movement, which is spin, roll, and slide. We have three types of glide in shoulder joint. First, we start with shoulder glide.
Okay, for this part, I will show to you guys how to do the counter glide. But before that, first we have to know the therapist position. So therapist need to stand beside the patient and in a lunges position. So to do this counter glide, we have two ways actually. First, we can use the hypotina and web space. So for this, I will choose to use hypotina. Okay, first I have to do the traction first, so that the joint in between have we call it as a loose pack. Okay, so traction, and then by using the hypotina, I will start to push it down and using my body weight instead of hand weight. Okay, so you like this. For the second one is a grade 2. Okay, for grade 2, I will use the larger amplitude oscillating movement. Okay, relax. Okay, for the grade 3, I will use the larger amplitude rhythmic oscillating movement up to point of limitation. Okay, relax. Okay, first of course traction, and then in grade 3, it mentioned to point of the limitation. It means I have to push down deeper than the grade 2 and grade 1. Okay, relax. Okay, for the grade 4, it use small amplitude rhythmic oscillating movement at very end range of movement. So it means, okay, relax. Okay, of course, traction first, and then I will push it down deeper, but in a slow amplitude. Okay, like this. I'll show you guys. Okay.
Second is anterior glide.
we're gonna do anterior glide for shoulder joint. First, we're gonna support the head. Next, we use wet space to glide. Traction. This is called grade 1. Okay, for the grade 2, we use large amplitude and do oscillating wet space at the proximal humerus and do traction. And next, we do a grade 3 with large amplitude with oscillating to the limitation. Lastly, we use grade 4, which is small amplitude with oscillating to the very end of range of movement.
And the last one is posterior glide.
Okay, this is for posterior glide. The patient can supine lying, and after that we can do traction first, and after that we can proceed to do the posterior glide. Okay, for grade 1, we're gonna do small amplitude and do it oscillating. Okay, and for grade 2, just like before, we have to do traction but with larger amplitude and oscillating movement. And for grade 3, we have to do just like before, do traction first and larger amplitude but oscillating movement to the point of limitation. So we have to push it deeper. Okay, for grade 4, we have to do it with a small amplitude and oscillating movement to the very end range of movement. So we have to do it more deeper than grade 3.
Wait! But first, before the treatment, we need to aware of the contraindication of the treatment, which is first, we can aware of the acute inflammation, joint instability, malignancy, fractures, and severe osteoporosis. Because of all these signs, may worsen if we do the joint mobilization. Thank you.